Hello, my name is Ron Kelusky. I'm the President and CEO of the Public Services Health and Safety Association. When I think of PSHSA, I think of a highly skilled group of professionals that are providing an incredible service to the public and broader public sector in Ontario. What surprised me most about PSHSA was the size and complexity of the environment that we work within. Government, or the public and broader public sectors, particularly health, education, and government, probably represents almost 1.5 million workers and well in excess of 10,000 employers. And I was quite astounded when I started looking at that, the size and complexity of the environment that we are working within here in Ontario. I think the best thing that's happened to the organization in the past few months is that we've started to learn to communicate better amongst each other. We've become better at sharing information, and we've become more aware of the opportunities that exist and the areas of interest that we can all share in to actually make the organization better. I think we're a tighter team, a better team, and a much more self-aware team. This past year for the PSHSA has been one of incredible transition. Not only are we working within a very restrictive environment in a sense that there are legislative restrictions placed upon us by the current economic situation, the arrival of a new CEO, changes within the administrative structure within the Ministry of Labor. So there's a lot that the organization has had to cope with in this past year. However, on a positive note, I think that the organization and its people have done very well in view of the number of challenges that it's been facing. I think some of the more notable successes of the PSHSA this year has been the creation of our consultation document in response to the Ministry of Labor's strategic review. We were encouraged by the participation of all of our stakeholders and the culmination of a document that I believe will form the basis of the future direction of where the Ministry of Labor is going with respect to occupational health and safety in Ontario. We've had a number of individual successes, largely attributed to the efforts of our consultants and professionals in the field, notably in the area of developing audit tools and solutions, particularly in the healthcare, municipal and education sectors. And we're identifying new and innovative approaches which I think will become the future of health and safety management, particularly with the work that we've done with the Leading Indicators project through Health Force Ontario. PSHSA is a people organization. The services and solutions that we provide to our clients are really delivered through the professionals that we employ. They are very dedicated and committed to the principles of health and safety. They are, I think, incredibly attuned to the needs and requirements of a variety of employers, whether it's a large healthcare institution that employs 12,000 employees or a small school board in the north. They have a diversity of knowledge. They are some of the most dedicated and committed people I've ever met. So I'm proud to be part of an organization that employs such tremendous people. The most challenging part of the environment that we have is really understanding the complexity of the market we serve. It's one size doesn't fit all. We have rural issues, urban issues, we have issues of size, we have issues of full-time, part-time, volunteer. We have boards and agencies and associations and umbrella groups and individuals, and it's sometimes hard to find the one common denominator to maximize the results of what we do. I think we're working very diligently to better understand the market we serve and the complexity and layers of the sectors that fall within that market. And you know, as a small organization with limited resources, we need to figure out a way of optimizing our resources to maximize and leverage the outcomes that we need. PSHSA it's completing the final year of its initial 3-year strategic plan. And that plan created a very solid foundation for which this organization can build upon. And I think we're in a good position to adapt to the changes that are going to be coming down in the near and medium term, based on the fact that a lot of the work was completed in the past couple of years, and now we can focus more so on the future. The current business model is largely based on the traditional model of the legacy organizations that ultimately formed the PSHSA. And we're finding ourselves in a changing environment. Employers have less money. There's fewer time available for the traditional methods of educating people. We've had to adapt and start looking and developing resources in the areas of e-learning, blended learning. We're looking more at collaboration versus PSHSA doing all the work itself. We have to look at who our market is, understand our market better and the needs of our market, and to be able to dive deeper into the various sectors that comprise what we were responsible for under the old legacy model. Healthcare, for instance, has multiple subsectors to it, that we can't just look at healthcare as healthcare. We have to look at healthcare as acute care, primary care, community care, long-term care, as each of those sectors have their own unique health and safety needs. And that's similar to government, municipalities, public safety, and education. So we need to adapt to the changing environment, and we need to continuously evolve our business model to meet the needs of our clients and constituents. In terms of trends, the external trends that ultimately affect this organization will include, continued economic restraint, flatlined budgets, and an increased emphasis on value for dollar and accountability. And this is not unique to Public Services Health and Safety Association. I think all of the health and safety associations that form part of the Ministry of Labor's Prevention Initiative, we are all looking at the effectiveness of what we do and the ability for us to measure our effectiveness in not only the number of people that we train, but actually the outcomes that we hope to achieve through what we do. Internally, I would say the trends are going to be the continued emphasis on improved communication, the continued emphasis on working together as a team, and perhaps less emphasis on individuality, because as we've started to analyze and become more aware of the market we serve, we also see great opportunities emerging that, a program created for one municipality in many cases is needed by all 458 municipalities. So we're looking to enhance our ability to increase what is coming from the field and being able to package that and redistribute it amongst all the sectors across Ontario. So I think that we're moving in the right direction in that regard, and I think that trend will continue. At present, we're engaged in developing our strategy for the next 3 years, and the main focus has been understanding our market and developing a business model that responds effectively to that market, and then based on the business model is looking at what is the best structure we can look at to support the business model to deliver the best services possible. We're also looking at how we communicate with our stakeholders, and that's all come about through the input we've received from staff and our stakeholders and our analysis of the market. And we've found that the more information we can get regarding the uniqueness of our market helps us understand the best type of model to deliver services to that market. So those are going to be kind of the focus of what we're looking at the next few months in terms of approvals through the board and through discussions with our funding partner, the Ministry of Labour. It's really difficult for me to predict where we'll be in 5 years. However, if we look at it in broad terms, I think there'll be some level of consolidation within the health and safety associations. Technology will play a major role in what we do and how we access and deliver programs to our clients. I think there'll be a greater understanding of the importance and value of prevention, education, and in culture within organizations, particularly in the public sector. There will be new methods of measurement that will replace the traditional lagging indicators. We will be and have been working on some groundbreaking work with leading indicators, and I think that in 5 years' time, what we are talking about today will in fact become best practice in the industry that we serve and are working in.